As the media shares footage of mass panic at grocery stores to worst-case projections of COVID-19, it becomes increasingly difficult to separate reality from made-for-TV scenarios. OAN America's Jenn Pellegrino sits down with a Johns Hopkins health policy expert to share the facts that you need to know to protect yourself and your family.
Well, Dr. Marty Makary, surgeon at Johns Hopkins, thanks for coming into the studio today. I know you originally wanted to be on Skype. I appreciate you braving
That's okay.
the
I've
studio.
Got the Purell.
Perfect. Well, you know, we really want to cut through the noise going on right now. There's maybe a sense of panic with the coronavirus, even though the general public has been told not to panic. We see it in the grocery stores. We see it with the hand sanitizer selling out on shelves. You wrote a recent op-ed and you said you believe that Italy is a preview of what we're going to see here in the United States. Can you elaborate on that?
Sure. Look, what happened in China, it was not transparent. They were not honest with their data, and Iran has not been honest with the data they report. But Italy has been totally transparent, and what we're seeing there is essentially a preview. And what we're learning is that this virus is following the playbook that was outlined by the Harvard School of Public Health 3.5 weeks ago that also predicts that 30 to 70% of the U.S. population could get this infection, and up to 1% could die from it.
So how close do you think we are from what you know in terms of finding a treatment or a vaccine to treat this? How much longer is this going to play out?
Look, I honestly don't think we're going to come up with a vaccine or a medication anytime in the next 6 weeks. And that is the ramp-up period until we hit our peak. The reality is we have the perfectly effective method of stopping this virus in its tracks, and that is good hygiene and isolation. So look, people need to be extra super careful for the next 2 or 3 months. It will be over by summertime. That's what pandemics do. It's what all pandemics have done. And we need people to be over-prepared.
Well, you see people comparing this in some cases to the flu. How do you compare it to some of the viruses and things we've seen in the past? How severe is it? You
know, this is worse than the polio epidemic. This is worse than SARS and MERS. But because it is relatively sparing of healthy younger folks, we tend to think that we're resilient. And we don't think of those vulnerable, for which there are millions of those in the United States.
When do people, say, hey, this symptom that I have, should I go in and get it checked out? Obviously, the hospitals are busy right now, doctors are busy. At what point should somebody go in and be looked at?
Well, if your symptoms are mild or minor, you should really call in first, because we don't want folks out there coughing, the virus around. But generally speaking, the virus is known to have a fever in the majority of cases. That is different from seasonal allergies or something caught in your throat. But assume it is everywhere, because it is pretty much ubiquitous now. Door handles, Uber car doors, you name it, it is out there, and people need to give up on hugging and handshaking for 2 or 3 months. Take precautions, and those at risk need to stay away from people and contact with anything except for essential services.
That's great advice. Dr. Marty Makary, thank you so much for coming in.
Good to be with you, Jen.
Want to see more videos like this? Click on the link below and subscribe to OAN America News on YouTube, and call your cable provider and kindly demand that OAN America News is added to your lineup. Call and subscribe today.